Hi, everyone. We are here to welcome you to the opening of our workshop on relationship-centered leadership.
I'm Christina Nelson. I'm a fourth-year medical student at the Frank Netter School of Medicine, and I'm a participant in this IPE workshop.
Hi, everyone. I'm Maya Doyle. I am faculty in the Department of Social Work within the School of Health Sciences.
Hello, everyone. I'm Peter Longley. I am faculty in the School of Nursing.
And hi, I'm Rahul Anand. I'm faculty in the School of Medicine. Really excited to be here and looking forward to this program.
So I'm going to be moderating this welcoming webinar. We've already introduced ourselves, and this is the relationship-centered team. So I'm just going to kick it off with asking some questions so that everyone can get an understanding of what this workshop and course is all about. So let's talk about, why do we care about leadership and leadership development?
So I have been a hospital social worker for most of my career, about 30 years, about 20 of which before I came to academia and came to Quinnipiac. I've been really lucky to work in wonderful teams filled with really strong personalities. And so thinking about who the leaders of that team are and how we're all leaders at different points within those experiences has been really important to me. I think a lot about how leadership is a trait. It's not a title. It doesn't matter who the supervisor or the manager is. It matters sort of who's guiding the team through the decision-making and the thinking around, the care of our patients. So I'm really enthusiastic, and it's been wonderful to be part of this team and sort of build this curriculum for the rest of you.
Great. And my take on leadership and leadership development as a nurse with over 25 years experience, and that experience is very diverse. I had critical care experience at the bedside, nurse management, patient flow of hospitals, data analysis, and operational finance. So as you can see, I tried to learn from many different perspectives on how can we come together and improve our healthcare system. And now coming into academia, I'm trying to take all of my experience and share it with students, but also the payment is taking all of your optimistic energy for change and being able to help keep me motivated moving forward. So in leadership and leadership development is more of a ongoing, continuous improvement to improve yourself or remind yourself of some of the skills that you need to continue to work on, and also network with other like-minded professionals that have the same spirit and ideal vision of changing healthcare. In leadership, I define leadership more like the Stephen Covey aspects, where it's more about providing direction and purpose, where management is taking care of the policy and the procedures of attaining that vision. So, and currently I am struggling with the leadership of our healthcare system. It's being managed very well, and there's a lot of disparity because we have a lot of people making very good money, and other people are struggling with the work-life balance of all the healthcare professionals, and the patient's the one who loses out. And it shows in a lot of different areas and databases throughout the world. Rahul?
Yeah, thanks, Maya and Peter. Christina, it's a delight to have you in this program. We've been on a journey together. So my why for this program, I've been here at Quinnipiac for 5 years now and came through my own journey of burnout and came here and see, because of all the systemic reasons, we have a lot of emphasis on teaching the what of healthcare, all the technical side, and we pay very, very little attention to the why and maybe teach a little bit of the how of doing it. And the experience of teaching trainees, just the technical side, felt to me just like loading passengers on a Boeing plane knowing that if you load 100 of them, more than 10 are going to crash down the line. We send our trainees into a very stressful, difficult, challenging environment. And that's really the why of our work. And as we started to work in leadership development, the biggest lesson that I've learned is that it's really about the people and the relationships. And this little IPE family, just a fantastic reflection of that mini capsule of relationships amongst each other. So as our part of our IPE fellowship, it's been a great joy to take some of the things we've been teaching our med students about leadership and try to now bring that to a 2.0 version as to what's going to be meaningful for all health professions. And I'd say that this is very much a pilot. So it's very much focused on you, the student, and what you want to get out of it. And all of us, that's really the why and what matters most to us in this program. So we are very much willing to flip over every assumption we've come in with if it helps you meet your goals of being your best self, of building those relationships and leading teams, and of making your mark on the system.
Awesome. Really beautiful responses from all of you. So what should students know before joining the first session?
I suspect the first thing they're going to want to know is, what is this workshop about? We have some big ideas that we're going to try to make sure that we cover. We're not going to teach you about that today at all, we promised, but we want to just give you some of the quickly ideas about what we will be covering, and then we'll tell you a little bit about the how to get you started. So we can start with just first the big idea of leadership and what is leadership and what is teamwork. And of course, we're also going to nest that within this interprofessional practice, interprofessional education framework. That's why we're all here.
Right. I would expand on that, trying to come in knowing what is your definition of leadership and what are some examples of good and less optimal leadership examples that you have throughout your life so far, and how can that be improved? Some other things are, what are barriers that you have seen for optimal outcomes? These are real things that you're going to bump into because we all are humans and we come with our own experiences. So just kind of get your neurons firing around your experiences around leadership and relationship, and then how you're going to just have it at forefront so it can be something to discuss and get something very valuable out of this workshop.
Yeah, thanks for that. And what I'd add is that what we want you to come in knowing is we want you to come in having done a little bit of work about who you are, why you're taking this program, what outcomes really matter to you. I think that's important to think about. And then as we've worked on the structure of this program over the last few months, we wanted it to be longitudinal so that you have some time to go through that journey of development. On the other hand, we had to shrink it as much as we could so that it fits in everyone's schedule and the semester. So the first workshop is, focused on building the foundations. What is leadership? What's emotional intelligence? The basics of teamwork, while keeping it as interactive as possible. And then as we go from the first workshop to the second one then becomes a lot about simulations and playing a leadership and teamwork simulation that we just practiced last week and had a lot of fun doing too. So coming in and applying all that you've been absorbing over the first few weeks. And then the third one really gives us a chance to go from that first self to teams in the second one, to really putting it all together and also bringing in a systems project. So in the last session, we'll celebrate, we'll all share our learnings and takeaways from this program, and then we'll bring to the table a team project that you work on during the length of this program, and that helps to bring in these competencies in a not just a patient-centered way, but really a people-centered way, the patient as well as every member of the interprofessional team.
Awesome.
Well said.
So in addition to students doing their own self-reflection prior to the course, is there anything else that they need to do before showing up for the first session?
So there's two main steps that they need to do. I'll talk about the first one, which is, of course, logging into the Blackboard for our workshop. And there will be a relationship-centered leadership learning portfolio document. They're going to use that document throughout the whole course. And the first section has a reflection to do before we get started. So it would be great if folks can get to that before the first day that we meet on the 3rd. And then I'm going to let the others talk about the other steps and the book that we're providing for you as well.
Perfect.
Yeah, I can dive in about the Connect book. So one of the things that we found most impactful in building these relationship competencies, what the Connect book that's provided for you is that this book walks you through what are the competencies in building an exceptional relationship. What are some of the tools of this toolkit? And we'll go over them through little excerpts over the course of this program. And it gives you some scenarios that are very real life and relatable as to how these different competencies are applied. So over the journey of this program, we're going to use the Connect book to build that scaffolding of what a meaningful relationship, an exceptional one, means to us, and how can one go about implementing maybe just the big 3 tools you can pick up from the book and be on our way to building better relationships, both in our personal lives as well as in our interprofessional workplace.
Great. And I guess the last part would be just start drafting responses in the leadership portfolio about what brought you into healthcare. Really trying to understand what's the genesis for you moving in this direction. And why are you coming to this program, right? Is it something that's it's empathy, it's speaking to you and resonates in your being, or whatever is driving you? And then what would make it successful in your world, right? What's going to make it, you're going to be like, wow, I spent 3 days in this workshop and it was well worth the time spent. So just start thinking about those and put them into your portfolio.
And I just want to add a reminder, and Rahul, you said this already, this is a launch of a new program. So we are really excited to also constantly be getting feedback from you. And right, hopefully, good leaders are good listeners. And so we really want to listen to all the feedback that you have to give us as we build this. You are really part of building this. You are not just recipients. You are really co-constructing this with us. And we're really, really, really excited to move forward.
Yes, we're really excited. We can't wait to meet you, listen to what brings you to the table, what's going to make this a success for you, have lots of fun together, and learn along the way.
Excellent. Happy, and we'll see you soon.
We will. I want to give Christina the last word here, since Christina has certainly been involved in some of our leadership journeys. Christina, do you have a message for students having taken some of that journey and continuing with us?
So I think that the one thing I do want to say is that the Connect book that Dr. Anand mentioned in the question of what you need to know as a student joining this course is that Connect book literally changed my life. And seriously, in so many ways, my personal relationships, my professional relationships, and other aspects of the leadership course also really impacted me in so many ways that I'm so thankful I took it. And I think that anyone else who takes it also has so much to gain from it. And that's all.
Thank you for that. It's really a joy and honor to listen to that. Thank you. We really look forward to seeing you all.